Herpes zoster involving the S1 dermatome. Definition: Herpes zoster is an infection resulting from reactivation of the varicella zoster virus that affects peripheral or cranial nerves.
Severe pain usually precedes the eruption of blistering rash or herpes zoster that is restricted to a dermatomal distribution as it is seen in these patients. More than one dermatome may be involved, but this should raise the possibility of an immunodeficiency state. In the cranial nerves, herpes zoster has a predilection for the 5th and 7th nerves. Ophthalmic herpes occur due to involvement of ophthalmic division of the trigeminal nerve, and Hutchinson sign stand for rash of the tip of the nose due to involvement of the nasal branch of the nasociliar nerve. This is a very important warning sign of involvement of the ophthalmic branch. This patient has blistering rash of the external ear due to involvement of geniculate ganglion with facial palsy, a condition that's called Ramsay-Hunt syndrome. Management should include acyclovir 800 milligrams 5 times per day per orally for 7 days.
Application in medicine. Acyclovir, valacyclovir, and fanciclovir have efficacy in acute herpes zoster and are used to ameliorate postherpetic neuralgia. If possible, they should be given within 72 hours of rash onset.
Hello, and welcome to Online Derm Clinic. I'm Dr. Chris Schock. In this tutorial, we'll talk about therapeutic options for the very common reactivation of chickenpox known as herpes zoster, also known as shingles. Let's delve into the therapeutic options for herpes zoster. Again, it's also known as shingles. It presents as a localized, painful, blistery rash. It does not cross the midline of the body. Well, if you have zoster, it's important to initiate early therapy. There are oral and intravenous or IV antivirals. Usually, oral antivirals are treatment enough. There are a few cases where zoster may involve the ear or the eye, where intravenous or IV antivirals are recommended. Ocular involvement or disseminated zoster, that means is you have shingles and zoster and you're immune suppressed, and the rash isn't just confined to one region, it can spread over much of the body, kind of like chickenpox. That may require hospitalization because of potential for internal involvement. Again, early therapy is important because it decreases the severity of the condition, and it also decreases the chance of developing what's called post-herpetic neuralgia, which is persistent shingles pain that can last for months or in some cases years.
Disadvantages: people will feel pain or extreme sensitivity in the skin, photosensitivity, headache, and fever.
Herpes zoster, commonly known as shingles and also known as zone, is a viral disease characterized by a painful skin rash with blisters in a limited area on one side of the body, often in a stripe. The initial infection with varicella zoster virus, VZV, causes the acute, short-lived illness chickenpox, which generally occurs in children and young people. Herpes zoster symptoms. The first sign that a reactivation of the chickenpox virus is taking place is a burning sensation on the nerve parts along which the virus is traveling. The rash is typically accompanied by a fever and enlarged lymph nodes. Fever, chills, upset stomach. Fluid-filled blisters can appear on reddened skin. Some patients develop postherpetic neuralgia. Herpes Zoster treatment, although antiviral medicines such as aciclovir, Zevirex tablet/suspension can be used, they must be started as soon as possible when the burning sensation begins. Once the rash has been present for more than 48 hours, treatment will be at reduced value.
Diseases: bacterial skin infections, blindness, deafness, infection including encephalitis or sepsis, Ramsay-Hunt syndrome, or if shingles affects the nerves in the face.
I'm Gabriela. I'm a physician and director of research at the Olmsted Medical Center. And today we're going to talk a little bit about an article that's coming out in the Mayo Clinic Proceedings, Herpes Zoster, Eye Complications, Rates and Trends. Now, this study was done in the Olmsted County population. And as many people know, we have something called the Rochester Epidemiology Project. And that allows us to link data from all of the healthcare clinics in Olmsted County. So when we talk about population base, we really mean the whole population. Anybody who seeks medical care at any of the sites. And we believe that's about 98% of all the individuals who live in Olmsted County. So this study looked at all of the people who had herpes zoster or shingles from 1980 to 2011 in this community. We had about 2,000 confirmed cases, 2,035 to be exact, and looked at the medical records for every one of these cases to identify eye complications. Not just herpes zoster ophthalmicus, which means that it is in that nerve branch, but doesn't necessarily have eye complications. And what we found was there were 189 episodes of eye complications in 184 people. There were some people who had more than one episode, and we talked about recurrent zoster in another paper I wrote also in the Mayo Clinic Proceedings.
Oh, okay, thank you.